A warm welcome to the Wednesday edition of the Our City COVID-19 show, giving you the latest news and updates from home and abroad. I am Michaela Miller. These are your headlines for today. WHO welcomes findings on dexamethasone as a treatment for COVID-19. Denosa concerns over nursing student safety, and World Cup mourns for Dr. Fuad Jakut, who died of COVID-19. It is day 83 of lockdown, and the current number of confirmed COVID-19 cases nationally is 76,334, with 42,063 recoveries and 1,625 deaths. In the Western Cape, there are 45,357 cases. 1,200 people have died and 30,236 have recovered. There's been a breakthrough in the fight against COVID-19. New clinical trial results have found that a widely available steroid can be used to treat critical ill coronavirus patients. Dexamethasone is manufactured right here in South Africa. It's been used since the 1960s to reduce inflammation. It's now been proven to reduce mortality by about 1/3 in COVID-19 patients on ventilators. And for patients requiring only oxygen, mortality was cut by about 1/5 in the clinical trials. The World Health Organization has welcomed the findings. Many more lives could be saved if the gap between private and public health care were closed. That's the word from the People's Health Movement of South Africa. This is a report by Equal Health for All.
I'm Lydia Kenkros. I'm a doctor in a public sector hospital, and I have an interest in how we manage this pandemic in a just and equitable way.
We have a public-private health system where the majority of the money is spent on the minority of people. And so people with medical insurances and medical aids in South Africa have sometimes the world's best care, whereas our public sector patients get sometimes the worst care. And so we have to find a better way of managing our health system.
We know that most intensive care beds are in the private sector. We also know that the government has come to an agreement with the private sector about pricing for private healthcare. But what we have not seen is an agreement about a uniform set of guidelines between the two sectors. The guidelines that we use in the public sector for many illnesses are partly driven by best clinical practice, but also driven by resource scarcity. In other words, we can't always do the best that we would like to do because the resources are limited.
Now you've got doctors who might be having a public sector patient and a private sector patient. This one's funded. This one isn't. And if you go and do your full protocol on the public sector patient, you won't get paid for it. Because the public sector has got to deal with you. We're going to pay you only so much. There's a huge problem of equity.
The need for this agreement on a standard set of guidelines is particularly urgent right now, as in the Western Cape we are seeing the ICU beds both in private and in public filling up. We cannot have a situation where the ongoing inequality in healthcare, which we've seen for decades, continues during the COVID-19 pandemic.
What's going to happen when people go to a private hospital thinking that their government has made a plan for them, and the private hospitals are closed or the private hospitals turn them away? What's going to happen? How do we explain to our citizens that we didn't get round to having a scheme that supports them wherever they are? We didn't get round to funding a system where every citizen in this country has the right to the best care that they can be given, irrespective of whether they have a medical aid or not, and irrespective of whether they're in the public or private hospitals in our country.
We have over 15,000 private practicing doctors in our country who have been willing to step up to the national response in the interests of the country, because they are doctors trained in South Africa within the same ethical envelope as their colleagues in the public service. You want them all on board. You want them all operating in a seamless way with their public sector counterparts in mitigating the crisis.
What we're calling for is empowerment of the clinicians who are on the ground, who are doing this work. They should be the ones who are coming together, not as doctors and nurses under private or public, but as one set of health workers that are coming together and making the best possible guideline for all of our people. We would like the Department of Health to facilitate that, and we would like that to be a transparent and open process that takes into account the best medical evidence and also the resources that we have. Knowing that the medical evidence is changing all the time, at the same time we know that our guidelines need to shift, but how that is done and how that is benchmarked against best outcomes versus resources needs to be clear and open for everybody.
Meanwhile, final year medical and nursing students are being deployed to hospitals around the country to help in the fight against COVID-19. But there are concerns for their health and safety. The student movement of the Democratic Nursing Organization in the Western Cape said it was worried about nursing students contracting the virus. The NOSA wanted assurance that adequate personnel protection equipment will be provided.
Okay, as the provincial student movement, we are concerned about the safety and the readiness of campuses. Understanding that most students were sent home by the various universities and colleges. So now our issue is, when these students come back to campus, are their campuses going to be ready? Is their safety guaranteed? And also the issue of PPE. As you can see, most hospitals and staffs that are already there are complaining and been voicing out their issues over PPE and adequate safety. So that's generally our issue as the provincial student movement. At this current moment, ours is to make sure that we reach out to as many students as possible. Thirdly, because we are under the impression that the DOH is the one who should assure us about these things before the university due. So ours is to set up a meeting with DOH. From there, we go to university. We are aware of one university that is not allowing students back, which is CPUT. The Peninsula is not allowing any of their students back on campus because of the worry of COVID. UWC has made available saying their students will commence work at the mid of fourth term, which is mid-September. So we want to make sure that by then all these measures are put in place and the safety of our students is addressed, mainly in these institutions. Also, we are fully aware that COVID is not only highly in these two hospitals that we mentioned in our statement, it's also highly in other hospitals and other places. For example, in Kailita Hospital, we are fully aware of those numbers and also the scarce of resources when it comes to ensure the safety of workers. So now ours is to make sure that by the time students are allowed back into placement, all these measures are made to. If not, then there's no work for students.
The Provincial Health Department said it was committed to ensuring the safety of all healthcare workers, including students.
Western Cape Government Health remains fully committed to the health and safety of their health workers. We understand and recognize the anxiety of all health workers, including students, as we face this unprecedented threat of the global pandemic. During this time, it remains very important for us to take care of our staff, who in turn take care of the vulnerable sick people in our health system. We have taken many efforts to improve staff safety, which includes the establishment of an internal occupational health and safety work group. As part of this, a range of policies and guidelines were developed. These practices were implemented everywhere. It includes the issuing of protective equipment in accordance to risk profiles, implementing measures to protect the families of staff members, as well as isolating vulnerable staff from hazards where possible. A risk assessment tool has been developed for vulnerable staff, which ensure that staff are graded according to their risk profile to be assigned to lower risk areas. More than 20,000 healthcare workers were given flu vaccinations, and the Red Dot taxi service was implemented to transport healthcare workers to and from work, ensuring their safety free of charge. Healthcare workers are prioritized for testing if they test positive for COVID-19, and they will be allowed 14 days to isolate themselves. We continue to work with all stakeholders to ensure the safety of the entire workforce.
Condolences are pouring in for well-known Boer-Kaap family doctor Fuad Yakut. He died on Tuesday after contracting COVID-19 a few weeks ago. The Boer-Kaap Community Response Team said Dr. Yakut's death had come as a shock. The 69-year-old was admitted to hospital on the 2nd of June with pneumonia. He tested positive for COVID-19 shortly afterwards. Many had hoped he would recover, but he succumbed to the virus earlier yesterday morning. Dr. Yakut was buried according to Muslim rites.
Sadly, we have lost an icon in our community, our beloved Dr. Fuad Yakut. Not only was he a medical doctor, he was a humanitarian, a husband, a father, a brother, an activist, a man with deep spirituality that was loved and highly respected, an icon in the Boer-Kaap community. He did not only serve Boer-Kaap, but many other communities at large. The mood in Boer-Kaap is somber on the loss of this wonderful person.
To COVID-19 related news from further afield now. A group of community doctors in the Democratic Republic of Congo have started making home visits to treated coronavirus patients. It's the first program of its kind in the country. This report was filed by Voice of America.
25-year-old Jeanne Gono says she has a health condition that needs regular monitoring. But she hasn't been to the hospital for 4 months because she's afraid of being exposed to the coronavirus. Instead, a doctor from non-profit group SOS Doctors Cameroon is visiting her at home.
I feel safe at home compared to the hospital. When you go to the hospital, you don't know who you're going to meet on the way. The taxis you'll take, you don't know who is sick or not.
Like Ngono, many people around the world are afraid to go to hospitals, according to the United Nations Population Fund. Medical experts say they understand this, but urge patients to continue to stay in touch with doctors and hospitals.
If there are initiatives that can add value, they should not be rejected. But I would like to say, in my humble opinion, I believe that the hospital is the best place where the diagnosis can be made and the patients well oriented.
Et les malades bien orientés.
The group SOS Doctors Cameroon includes 30 doctors in 5 cities. Patients can ask for a consultation on the group's website or Facebook page. A visit costs almost $34 US, twice the price of a hospital consultation. Despite the cost, requests for home visits have jumped from about 20 in March to about 100 per month now, according to SOS Doctors Cameroon. And the group is continuing to find new ways to provide service.
We realized that it was mostly routine consultations. It gave us the idea to set up a remote assistance service, which is done by WhatsApp, to chat 24 hours a day, 7 days a week with a doctor, to ask any type of medical questions.
The demand is expected to continue. Cameroon has confirmed nearly 10,000 COVID-19 cases, one of the highest number of known infections in Africa. For Anne Zwanke in Yaoundé, Cameroon, Moki, Edwin Kinzeka for VOA News.
We'll be back after the break with all your latest news from the city, province, and around the world. Stay with us. Welcome back. You're still watching the Wednesday edition of the Our City COVID-19 News Show. Another tragic double murder has rocked the Cape Flats. 38-year-old Nathan Easterhuizen and his 3-year-old daughter Eden were shot dead on Monday. Easterhuizen was dropping off his fiancée Teasel Stevens for work when the shooting took place. Stevens believed it was a case of mistaken identity. Their toddler was in the car at the time and was caught in crossfire. She was rushed to Red Cross Hospital, where she was later died. I spoke to the distraught mother on Tuesday. In an emotional interview, she recounted what happened on the day her fiancé and daughter were gunned down.
Stevens, Erin Easterhuizen se mami, die babytjie van 3 jaar oud. En Nathan Easterhuizen se aanstaande, soos normally ons oggendroutine doen op 'n maandagoggend. Het ons maar nou hy van my werk toe gevat, gedrop by die taxi, soos normal, vir hom gesoen, by Erin gesoen. Erin, maar altyd vir my gesê, mami, bring, wat gaan sy vir my saam bring? En ek het vir haar gesê, ek gaan vir jou iets bring. En ek is oor die pad, en ek het so in die middel van die groot paai, so 'n lyntjie daar gestaan, en ek het net klomp gunshots gehoor. En die guard wys vir my, ek moet buk. In die tyd wat ek buk, wat ek opkyk, toe sien ek maar, daar staan ons kar stil. En ek, in my spoed, al loop ek weer terug. En toe ek by die kar kom, sal ek sien die klomp skote, koels, deur die driver's side fence, en ek het al twee deure opgeruk. En het geskree, Here, my kind, my kind. En ek kon gesien dat ek kon die moment gesien dat daar is liewe in Nathan nie. En my kind, het haar hand tussen die twee seats van my opgelig. Toen my kind op die daar stond. Ja, gat in my kind se kop. Haar voorkop was plat. En die groot gat agter haar kop. Die kaart het die law enforcement wen gestop. Ek weet nie hoe vinnig het ek in hy wen gespring en ons is daar hospitaal toe. Ons het daar gekom, my kind aan die liewe gehou. En hulle het vir my gesê, sy gaat oukei, sy is 'n fighterkie. Sy het Rooikruis hospitaal toe gegaan, waar my baas vir my baie mooi bygestaan het. Dankie Liesel en Nathan. Hulle het by my gesit en dokter het vir my geroep om vir my te sê, dit gaat staan, want natuurlijk was die pyn seker te veel vir my kind. Die polisie, Ravensmead, even Elsie River, hulle het vir my baie lekker gehelp. Maar ek voel ons moet teruggaan na level 5 toe even, want die skietery het niet begin worse word. As hoeveel kinders met hulle paans in die tyd geskiet, about 7, as het nie meer is die en ek weet nie, hoe gaat ek maak, as nou Sondag, as nou met Vaders Day, ja, Nathan was regtig my alles, my kinders ook, maar die man, hardwerkende pa, het gelewe vir my, vir sy 2 kinders.
The man accused of murdering Sibogenseni Kabada appeared in the Khayelitsha Magistrates Court on Monday. Sitembele Klaas's appearance followed an online petition by Lethla Lambantu and other efforts that called for him to be charged with murder. The case was dropped earlier due to the inconclusive evidence. The 34-year-old victim's dismembered body was found in a bag next to a shack in H section in Khayelitsha. The case was one of several recent incidents of gender-based violence across the country. We spoke to Sia Monakali, communications liaison for Letha Lambantu, for more.
The murder accused first was arrested on Sunday evening or Sunday afternoon, and then he appeared at the Kaikicha Magistrates Court for the charges of murder. These charges are new to the case. These charges obviously from the pressure that we actually applied through the petition and the support that we got, we wanted him to actually be charged for murder rather than any other charge. We appeared for the first time at the first appearance where his charges were read to him in front of the court, and the investigation was going to go through. However, obviously, with every court case, you do get bail hearings. So the bail hearing for the accused will be on the 15th of July. That will be something that also we will be contesting. We will write a letter to the prosecutor and ask that there be no bail. It was a combination of things. It was obviously the petition and obviously the pressure that we put on the justice system, because we wrote letters to the NPA, and we also called the commissioners here in the Western Cape. Throughout this court case, we will be obviously we're still providing support, emotional support to the family, and we will be doing pickets. But obviously, because of the restrictions of this lockdown, we are limited in terms of our numbers. But in terms of community mobilization and actually getting people support around this issue, the community is well behind us.
Memorial service has been held for slain taxi driver Rodney Jackson and his god Graham Mart. The two were shot and killed last week in Maitland Street, Bishop Lavis. Police say the motive for the murders were robbery. Our city reporter Stephanie Pitt has more.
Rodney Jackson and his godchi are the latest victims of crime in Bishop Lavis. Dozens of people gathered for a memorial service yesterday. Among them, the Bishop Lavis Community Policing Forum, taxi drivers and religious leaders. They called for an end to the senseless murders that have been happening in the area. Community leaders met with police last Friday to plot the way forward. I spoke to Amanda Davids a bit earlier. She is from the Bishop Lavis Community Action Forum. This is what she had to say.
I'm going to put it like this. It's the Bishop Lavis precinct. And that's where our worry comes from, because the railway line is one of our big problems areas. And the sore point about that is that we did let SAPS know. We were in several meetings. As you know, the shutdown happened in Bishop Lavis. That was one of the demands, that we want a base camp there. And since then, we've had several meetings. We had meetings with Dan Plato. We had meetings with Becky Taylor, who came to Bondiero to speak to us. And lots of promises were made. And now we're seeing with the COVID-19 pandemic, the resources are going out of our areas towards COVID-19, but they're forgetting that we're still gang infested. So now the gang violence is flaring up again. This was purely robbery that Rodney and his taxi guard was purely robbery. The thing is, it happened before. A couple of weeks back, the same crew came and robbed the Bangladeshi shop owner, shot him to death. We knew there was a problem, and nothing was done about it. The thing is, it's preventable. And in Bondiero, the same thing is happening in Bondiero. And it is because we know about 19,000 parolees were released now. Now, they're coming back into our areas. We don't know who they are. We don't know what the bail conditions, the parole conditions is. And they're not coming to the community and telling us, listen, these people are coming into your area. Please look out for this. Because at the end of the day, the community is the only people that know exactly what's going on in the community. And they're not involving us. For the first week, they were very visible, and they made people adhere to the lockdown. After that, there's no lockdown in our area. There is none. It's non-existent. So, which means everybody can just do what they want to, and the gangs are moving around freely. And the huge problem with this is the cigarette ban. I do understand the health issues with it, but now you will see law enforcement was in my street yesterday with a van and 2 cars and a full combi of law enforcement officers for cigarettes. Now, why can't they take that same manpower and go, if they catch one person on the street with drugs on him, take him back to where he bought it? Why can't they do that? Why are they going for the soft target? And that's the problem we have. SAPS, Metro, law enforcement, they're going for the soft target and they're not going for those big drug dealers. And we need them to do that. That's what they're there for. They keep on saying the community is not giving them information. They are getting the information. They're just not prioritizing it.
The City of Cape Town's law enforcement and anti-land invasion unit with the South African Police Service carried out a demolition operation in Handburg-Hout Bay just as a winter storm swept across Cape Town on Thursday. As part of the Youth Day celebration, the Cape Coloured Congress Youth League stood in solidarity with the families whose homes were torn down. They recruited members to help with the soup kitchen, handing out of blankets, hot water bottles and plenty more. The Cape Coloured Congress Group is an activist organization drawing awareness to current hardships with a vision of taking ownership of their future. Here is more of what they did yesterday.
So this Youth Day, we decided to head over to Handburg in Hout Bay to assist the 2 families who had their homes thrown down this winter. We went in there with the mindset and aim of assisting these 2 families as much as we possibly could with as much donations as we possibly could collect. But we came out there learning lessons in humility about a community that is invisible to the rest of our city, province and country. We learnt about a community where service delivery is unheard of, where the elderly and sick have to hike up mountains to reach their homes that have been flooded. These people live in undignified conditions. On Youth Day, we usually reminisce and look back on our fallen heroes, our Hector Petersons, our Ashley Creels. We share pictures and heroic stories from days gone by. But this Youth Day, we should really ask ourselves, is this what our freedom fighters risk their lives for? For our people to be forgotten, to be marginalized? I'd really look inside of myself and say, is sharing a Facebook post enough this Youth Day? So to say the experience was humbling and heartbreaking just doesn't do justice. It reinforced why we, the youth, need to be the change to bring about change, why we need to stand up for our people, why we as youth need to take our future into our own hands.
Today we spent Youth Day, June 16th in Hout Bay. It was great to finally meet all the youth leaders as well as EXCO members that came through for the day. We handed out soup and also fruits. We also gave blankets. We had a blanket drive and the experience was awesome. What I could see was youth wanting to make a difference in the community, and also has a genuine passion for bringing about change. So I was very encouraged by my entire team today and the passion they had and the way they spoke to community members and the way we all could work together as a team to see this first initiative come to fruition, as well as executing our plans.
It's unfortunate that our youth, or our leaders rather, have failed on their promises, have sold us ideals and dreams and changes and a better future, but they haven't followed through on this, and we are left asking why, and we are left asking for justice, and we are left wanting, but if anything, it is possible today. With what I've experienced, it is possible for the youth to put aside their differences from different backgrounds and different affiliations and different ideals and beliefs, that we can all come together for a common cause. This is what our leaders have failed to do. They've allowed their differences and their infighting to engulf them so much so that they are basically incapable of carrying out the duties that we voted them in for. So, if anything, my message for the youth would be to take responsibility for your future. It is possible for you to, or it is possible for us to all work together, irrespective of who or what we are. Further onwards, yeah, that is my message, and that is my hope, my vision, and my mission for the future. Thank you.
And now for international news. Amid nationwide protests, US President Donald Trump signed an executive order outlining police reforms on Tuesday. He also said that he had met with several families who had lost loved ones in deadly encounters with police officers.
Thank you all for being here as we take historic action to deliver a future of safety and security for Americans of every race, religion, color, and creed. We're joined today by law enforcement professionals and community leaders. Though we may all come from different places and different backgrounds, we're united by our desire to ensure peace and dignity and equality for all Americans. I've just concluded a meeting with incredible families, just incredible families that have been through so much. The families of Ahmaud Arbery, Botham Jean, Antoine Rose, Jamel Robertson, Adiana Jefferson, Michael Dean, Darius Tarver, Cameron Lamb, and Everett Palmer. These are incredible people, and it's so sad. Many of these families lost their loved ones in deadly interactions with police. To all of the hurting families, I want you to know that all Americans mourn by your side. Your loved ones will not have died in vain.
That's all from the news front, but when we come back, Stephanie Pitt will give us an update on what's trending on social media.
Welcome back. You're still watching the Our City COVID-19 show. I am Stephanie Pitt. Let's take a look at the popular hashtags on Twitter today. Hashtag Tsegofatsopule. 31-year-old man has been arrested in connection with the brutal murder of a young woman who was 8 months pregnant. Meanwhile, Twitter is outraged by a tweet from a man who listed a number of reasons that could be why men kill their partners. Hashtag Day 83 of lockdown. As we head towards 3 months of being locked down and the continued economic fallout, many citizens are confused about why spending 30 billion rand on reviving South African Airways is a good idea. We'd like to know your views during this pandemic, so we'll be posting questions on our Facebook page daily, Our City CT. You can also follow us on Twitter at Our City CT. That's it from me, Stephanie Pitt. Please stay with us. After the break, Michaela Miller will be giving you information on resources and places of safety you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show on Cape Town TV, Channel 263. Here's a recap of today's headlines. World Health Organization welcomes findings on dexamethasone as a treatment for COVID-19. DENOSA concerns over nursing student safety, and WorkUp mourns for Dr. Fuad Yakut. If you are in need of any assistance, here are some organizations helping communities stay safe during this period. That's it from the Our City COVID-19 news show, but we will continue giving you the latest news on what's happening in Cape Town on our Facebook page at Our City CT and on Twitter at Our City CT. You can also get in touch with us via our email on ourcity@capetowntv.org or call us on 021 448 0448. We would like to pay tribute to all the technicians and pathologists in the National Health Laboratory Service and private laboratories, as well as all staff who work in the most risky environment 24 hours a day to churn out these results. From me, Michaela Miller, and our City News crew, goodbye.